Maybe they can trim it. Maybe not. No, they probably better not.
Hi, everybody. Okay.
Yeah,
Jose.
Yeah, I'm here. Mr. B, you're going to call me afterwards. Thank you.
Okay.
Uh,
I'm going to charge my phone then. I'll be right back.
All right, guys, we are live on YouTube.
Okay, I think we have a quorum? We have 1, 2, 3, 4. Yeah, we do.
Yep.
He'll be back in just a second. Welcome everybody to our Board of Health meeting for Thursday, March 4th. My name is Jose Avila. I'm the board chairperson. Calling the meeting to order and take attendance. Again, Jose Avila.
Gary Hens. Gail Pittman.
Steve Kurkowski.
See Du
Rick
Bois?
Baraboo. Rick Baraboo again.
Okay. Great. And do we have any guests? If we do, they'll chime in whenever. But just want to
let's just take a second and let them introduce themselves so we can put it in the minutes, please.
Certainly. Are there any guests today? Okay, I guess there are no guests today.
I think there are. Hold on one second.
Oh, okay.
Just have to get them unmuted.
Tech has to unmute it. It's still muted.
Yep. Okay. Well,
All right, Rosemarie Annonson, you can unmute yourself and put in on the record.
I just got an unmute and my computer is running really slow. I downloaded something and from Microsoft and anyway, Rosemarie Annonson, 3920 East Ryan Road resident.
Thank you. Thank you.
I think we might have other guests today. Hold on.
We also have Alan Redel, if you'd like to unmute yourself.
Yeah, I'm Alan Redel at 8800 South Country Drive, apartment 202.
Thank
Okay.
you.
And then we have a third person that's in via phone. Unfortunately, I don't have a name for this person. So if you want to unmute yourself, go ahead and unmute yourself and identify.
Do they have to push anything particular to unmute?
There we go.
Hi, Michael D'Amico. Sorry.
Oh, hi, Dr. D'Amico.
I didn't realize I had to unmute myself with a *6.
No problem. Are you going to be on the phone for the meeting?
I will, yeah.
Okay. All right.
Do I *6 to mute?
Yes.
Back to *6. Okay.
All right. Okay.
Great.
I think that's all of our guests then. Thank you.
Great. Well, thank you everybody for joining. We did call the meeting to order. We did have a roll call. Please include the guests and Dr. D'Amico in our attendance list. The first order of business is the approval of the minutes from the last meeting of January 7th. Members, we did receive this. Just if there's any comments, questions. If there be no comments or questions, I'd like to entertain a motion to approve the minutes as written.
So moved.
Okay, do I hear a second?
I'll second Gary.
Thank you, sir. There being no further discussion.
Actually, I'm not sure if Gary can second. I don't think he was in the January meeting, right?
Oh,
Yes, I was not there yet.
Right. So I think we might need someone else to do the second.
Alrighty.
I'll make a motion to, I'll second the motion.
Thank you.
Great. Thank you so much. There being no further discussion, all in favor?
Aye.
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 Opposed? Abstentions?
Hi.
Great. Thank you. All right. So first order of business after that is the health department updates. Darcy?
Okay. Thank you. I did send out just a very brief written report. I'll just go over the highlights of that report. Following this, I will go through in a more in-depth COVID-19 response overview. So I'm going to skip just the COVID-19 updates that are on there. The non-COVID-19 updates, we did receive funding from the state to begin implementation of a local overdose fatality review. So overdose fatality reviews are a process of reviewing fatal overdoses with a team, a multidisciplinary team, to develop recommendations that might reduce or prevent future overdoses. So we'll be working with the Cudahy, South Milwaukee, and St. Francis to implement a South Shore overdose fatality review. We'll be partnering with the police and fire departments, as well as a variety of other community partners to review overdose fatalities in our community. There is a Milwaukee County overdose fatality review already that meets monthly and reviews a small portion of fatalities that occur in the county, and a number of other Milwaukee County municipalities or zones also have already implemented a more local version of this. So we hope to have our first meeting by the end of the year. Hopefully we will be less busy with COVID and we'll be have some capacity to implement this new project. And that is my only other update. Any questions about that before I move on?
No, I have no questions.
Okay. The data looks very similar to data we've been reviewing for the past year now. Primarily, all of our time is continues to be spent on COVID. You can see here now that the immunizations are starting to register. So that's pretty much all of our data reflects our COVID work for this 2-month period. So we do continue to work, spend all of our time primarily on COVID-19 response. The good news is we've seen a significant decrease and decline in new positive cases. So as of today, we had 4,087 individuals in Oak Creek who've tested positive for COVID. I'm just going to go ahead and share my screen here. Can you see my graph?
Yes.
Yes.
Okay. So you can see that these are our weekly positive cases going back to almost a year ago when we had our first case. And you can see a significant decrease in new positives in the last couple of months. We're currently averaging just over 4 new positive cases per day. Got a second graph here that should show us that. There we go. So this is our new positive cases per day, the average number of new cases. So we saw a pretty big peak back in November, but it's been a steady decrease since then. We're also seeing a decrease in the total number of individuals being tested. That's been happening over the past, since really the beginning of the year. We've seen a decline in the number of individuals who are choosing to be tested. Our current burden rate here in Milwaukee, or sorry, excuse me, not Milwaukee County, in Oak Creek is 282 cases per 100,000 people. So that's based on approximately 103 individuals who tested positive over this 14-day period. Also can see the significant decrease that we've seen in our burden rate since a peak back in November. And our current 14-day percent positivity is 5.4%, which is the lowest that it's been since we've been tracking that. So really a lot of good news when we look at the data regarding new positive cases. Our South Shore testing site does remain open. That will remain open through the end of March. And at that point, we anticipate that it will close, talking about the site on the Bucyrus Erie campus in South Milwaukee. However, we have seen quite a few other smaller kind of pop-up community testing sites that have opened at various pharmacies or with other community partners. And so I do believe that testing will continue to be fairly accessible to individuals in our area who need to get tested even after that site closes. So moving on to vaccine, we really are spending the vast majority of our time and efforts on vaccine given the decrease in cases. So while the supply does remain limited still, we have started to see an increase in our vaccine allocations just over the past couple of weeks. The state is expecting their first allocation of the new Johnson & Johnson vaccine next week. And they have said that they do expect that by the end of March, we should have quite a plentiful supply of vaccine once the Johnson & Johnson is able to ramp up their manufacturing. So Good news on that front. We do continue to hold vaccine clinics 4 to 5 days a week in collaboration with Cudahy and South Milwaukee St. Francis Health Departments. We've given approximately 3,000 individuals their first dose of vaccine, and probably about at least half of those have received their second dose already. We're holding first and second dose clinics every week now. We had the last 3 weeks, we've been operating out of the Assembly of God, and just want to publicly extend my gratitude to the Assembly of God for being a really generous partner. And it was a wonderful location for us to hold our vaccine clinics. Starting next week, we will be in our new longstanding vaccine clinic site, which will be on Packard Avenue in Cudahy in the former Kmart location. So we will be in that location moving forward for the vast majority of our remaining vaccine clinics. We are very much looking forward to being in a space where we can stay long-term. That means we don't have to move tables and chairs and all of our supplies every clinic. It allows us to spend more time giving vaccines. So it will be nice to settle into that location. We have started vaccinating the newly eligible groups. So as of just this week, new groups that became eligible for vaccine include education and childcare providers, individuals in Medicaid long-term care programs, some additional public-facing essential workers, some non-frontline essential healthcare personnel, and congregate living facility staff and residents. So the state of Wisconsin has announced that they are setting aside allocation of vaccine for educators and childcare providers, similar to what they did for individuals in long-term care facilities. So they will be sending a separate allocation of vaccine for that group starting next week. And then we will hold weekly clinics dedicated for those groups so that they will be able to easily access vaccine. I'm going to share my screen one more time because I realize I have one more graph to show. So this graph is showing our vaccine rates here in Oak Creek as of this week. So on the left with the smaller bars, that's the percentage of our total population that's had at least one dose of COVID-19 vaccine, population who's eligible, I should say, so age 16 and above. Oak Creek is the green bar, so we can see that we've had 21% of our population have received at least one dose of vaccine. That is a higher percentage than both Milwaukee County and the state of Wisconsin average. On the right, you can see the data for the 65 and older population. So here in Oak Creek, 57% of individuals in Oak Creek age 65 and older have received at least one dose, which again is a little bit higher than Milwaukee County at 50% and the state of Wisconsin at 55%. So we are very happy that many of our older adults have been able to access vaccine, and we do continue to offer vaccine to that group and all other previously eligible groups in our clinics as well. We are still waiting from the state to provide the specifics of the group who will be next eligible for vaccine. I believe they might have made an announcement today that they hope to share that information next week. We don't know all of the groups that will be in that, but we do expect that adults under the age of 65 with underlying health conditions will be included in that group. There is no timeline yet of when they will become eligible. It will largely depend on vaccine supply, but given the kind of forecasting around vaccine supply, I would expect that that will happen in April, if not before. Are there any questions that I can answer?
Yeah, Darcy, how many cases have we totally had in Oak Creek of people that have been tested positive?
4,087
So what percentage is that?
of our population.
Yeah.
Let me get my calculator. I won't try to do that in my head.
I'm just wondering at what point between the people that have had it and the people that are vaccinated, are we kind of getting to the herd, immunity part of this?
Yeah, so that's about 11% of the population who's tested positive, I believe, if I'm doing my math right.
Yeah, so between the two, we're like at 36%.
Right. And
been vaccinated.
Right. We are. Yeah, I think we've got to look at it larger than Oak Creek when we talk about, making long-term changes, because we know people are coming in and out of Oak Creek. But I'm really, I was very happy when I ran that data report earlier this week. I wasn't expecting to see those numbers be quite so high, given how limited we know vaccine has been. So I'm feeling really hopeful that we'll get there sooner rather than later this year. Really am. Did you have a question, Dr. D'Amico?
I did, yeah. For those with underlying health conditions that will be coming in, do they need to provide any kind of verification for that, or is it just strictly on their word of such condition?
That's a good question. I don't believe that we'll require verification. That would be something that would be hard for them to get. Certainly, you know, we don't want to put a burden on the healthcare system of everyone asking for a letter or something.
I agree.
But I know, yes.
Yes.
But, you know, I would also say that because healthcare systems obviously, you know their patients and have access to the medical records, I would expect that that group will hopefully be getting many of their vaccines through their healthcare providers, similar to the older adult population. So, you know, obviously they will know who to target based on their medical records. So.
Okay.
Questions from other board members?
Yeah, this is probably preaching and, you know, talking to the wall here. And I know you've heard my frustration before, Darcy, but I'm really disappointed that the state of Wisconsin doesn't follow CDC guidelines with regards to vaccinating those with underlying conditions right now, because I mean, we're supposed to follow everything that Fauci says, but the CDC says that type 2 diabetics should be vaccinated now, but the state of Wisconsin chooses to play politics and just go on with other stuff. It's unfortunate that we have to follow what the state says, because if we chose to go our own way, I'm sure they would cut off our supply of vaccine. So that's my complaint, but there's not a person in the world that's going to change that, unfortunately. So I'm ready to go downtown with a sign that says anything left over, don't throw it away. Come out to the sidewalk and come get me after what happened last Monday. So I trust, Darcy, that if you have that same situation, you have a list of people you can call that will be there in 10 or 15 minutes.
Yes.
Good. You can put
We
my
do.
name on
We
that.
have not wasted any doses of vaccine. I'm happy to say that
Okay, well, make sure you put my name on that list, because I will certainly be there in 15 minutes, because you're right. Nothing should go to waste. I was a little dismayed that they didn't walk out onto Wisconsin Avenue and say, does anybody want a shot? But apparently they chose not to do that. So, okay, I'm off my soapbox. Thank you.
Darcy, just to let you know, thanks for all the hard work. I mean, you guys are doing a great job vaccinating the people, and we have a high percent to show about it. So you and your staff, thanks for all that.
Thank you.
Yeah, I know. I stopped by the health department, Darcy. They were doing vaccination clinic, and it seemed very organized and very low key. So that's really nice. It means that the staff are prepared and ready, and all of that. So thank you for that too. Anything else, Darcy? Health department updates?
Those are my updates. If there are no other questions or comments from the board, I believe we have a guest who has would like her 3 minutes of comments.
Okay, and I would remind the guests that please, it's reserved for comments only. So, and again, it's a 3-minute limit for comments. Thank you so much.
I have 3 comments. When you move into the Cudahy facility at Kmart, how many of our Oak Creek staff will be going?
It will certainly vary day to day, but we'll be staffing them the same as we've been staffing all of our vaccine clinics thus far. So staffing is split between our 3 health departments.
Can you give me a real number?
I mean, it varies day to day. I would say anywhere from 5 to 8 of our staff are over there.
So that means that the 9 volunteer or the 9 transfer in staff will be going also to the clinic.
Yes, many of our contact tracing staff have been reassigned to work vaccine clinic due to the decrease in cases.
Can you, as Steve says, there is a need for pre-existing conditions, people that are more vulnerable that want this in vaccination. Is there any way that you can call it?
No, we are obligated to follow the state of Wisconsin guidelines based on who is eligible. And if we don't, we risk losing our supply of vaccine. So we do have to follow their guidelines.
Okay, back to the graph that you were showing us comparing the state and the county and Oak Creek. You didn't give us any real numbers. Can you
Can
tell
share
us?
that again. Sure. Then you mean the percentages? I don't have the numbers right here. I just have the percentages.
What I'm looking for, Darcy, is in Oak Creek, are we having 50% of the people? Are they turning out 60, 30, 90? What are we getting?
Right. So in Oak Creek, of our population 16 and above, 21% have received one or more vaccines. And of our population 65 and above, 57% have received at least their first dose.
What was that number on the 16 and above?
21%.
21%. And those, though, that's not open to the general public yet.
Right. So those are people who have fallen into the eligibility categories, such as first responder or healthcare worker.
Okay. What about city workers?
Those who have been eligible have been offered vaccine. So police, fire, health department staff, some of our utility workers.
I'm noticing the police are wearing masks, which is good. But the girls at the front desk, I mean, they're kind of like first responders.
Yep, we've taken lots of precautions with masks and barriers to protect them. And as soon as they're eligible, we will offer vaccine.
All right, thank you.
Thank you.
Thank you.
Do I have to unmute?
I think that the moderator will mute you again. Okay.
Great. Thank you, ma'am, for your comments. Appreciate it. And then next on the list is environmental health updates. Mr. Dale Pittman.
Hi there. Not a lot to report other than since our last meeting, I've issued 6 new licenses. One's a restaurant and the other ones are mainly retail food. They're small, like 1 or 2 person operations and making some kind of food item to sell. So 6 new licenses there. And then right now I've got about 5 that are in the works, 5 new licenses in the works. One tattoo place went out of business, another one's moving in. And then this spring I'll have a couple new pools to get up and running. Health space, we're still in the transition with as far as with the fee schedule from the old to the new. So their DATCAP is still working on that for me to get all that inputted in so that our new fee schedule will be reflected in health space. So that's something that they have to do versus me having access to it. So, and then a year from now, I just found out today we got to go to a whole new health space system. So that'll be interesting transitioning with my inspection system, how I document. So that'll be all changing in about a year from now. So other than that, anybody got questions at all or?
No. Thank you very much. If there's no other discussion, let's move on to old business.
I think there's a question,
there's a question
or a comment from our guest.
Okay.
Dale, last week there was a day with an air advisory. Do you monitor that at all?
No, I do not. Yeah, it was something like that. I don't know if that's air advisory from the state. No, I don't get any information on that.
It seems like it was about 3 or 4 days. I caught it on the last day. And it was during that period where we had the hot sun and no wind. And things were moving in from the south and the air was kind of just sitting here. So who in the city monitors that, Steve?
I don't know.
Well, environmental health With
It's
the
not right. We don't monitor it day to day.
Well, they advertise it every day on their website. And we really should have an alert for the residents in the city, no?
It's something that we can look into.
Is there a mechanism to measure that locally?
They're measuring at the power plant. They're mandated to measure, and they post it daily on their website. Sometimes we pick up the advisory. I believe it's on the patch. But at that point, if you have any medical conditions, respiratory, children with asthma, they really shouldn't be outside. They recommend that you not leave your pets out of doors. So we have to have some way of alerting the residents in the community.
I don't know if you're talking about the same thing, Rosemarie, but I get notification on my phone through the weather channel when there's anything going on like that.
Well, then you caught it too.
I see it on there. I don't really pay that close attention to it.
All right. But I think that that's something that we really should keep the residents informed of.
Thank you for the comment.
Yeah, thank you very much. Any other comments from anybody else?
I have one. I just thought of this. Dale, that new system, who's mandating that? The new reporting system.
Well, with the state of Wisconsin, I guess the current system, HealthSpace, they're discontinuing supporting this as of 2023. So DATCAP has to find a new system, and basically it's going to be kind of it's going to be with HealthSpace, but it's going to be a different system that they're promoting. So they've already, I guess, signed a contract with them, and then basically they got to implement it into all the local health agents around the state and also at the state level also. So it's going to be.
Is that something that the city's going to have to buy, or is that the state going to fund that?
That'll be at the state level. So
Okay.
It won't be anything here at so it'll be at the state level. So yeah, nothing that we have to really do other than learn a new system and get it loaded onto our computers and stuff, the ones that use it. So.
Okay, thank you.
Great. It's a good question. If we can move on to old business. Anybody have any old business to bring up? Okay, no old business. Any new business? Okay. Any closing comments before we end the meeting then, unless there's anything else that needs to be addressed at this time? All right, well, I echo what Rick said earlier is thank you, Darcy, to you and your staff for diligently working and collaborating with the other health departments in providing the vaccines, et cetera. And if there's anything we can do to be of assistance, please let us know.
Thank you.
Otherwise, thank you for all that your staff do. And I know it is difficult to, kind of know where you're going to be for the day, but I know you guys are flexible and are always willing to put in that extra time. So thank you so much for that. And yeah, I know I've been vaccinated already because I'm a healthcare worker, and I'm sure Dr. D'Amico has too. But so I think that, just to reiterate, I think the vaccines are safe. I think the more people we can vaccinate, and Steve, I hope we get you in there. I'm rooting for you.
Yeah.
If I could, I'd get you one. If I could, I'd get you one.
It'll happen. It'll happen.
But
because that's where I got mine at Myers.
Well, I'm only 63, so I
look
gotta
50.
wait.
Oh, okay.
Oh, you look younger. Oh, my
I'm
goodness.
almost 70.
All All right. Well, you know what? Thanks, everybody. And again, thanks, everybody, for all that you're doing in your various roles too, Denise and Dr. D'Amico and Gary. You keep us always supplied with the juice. So thank you so much for that. Mr. Steve and Dale, keep them restaurants coming. You guys, Van Winkle Distillery. Wow, cool.
Does that make Gary an essential employee?
Yeah.
Well,
Essential business.
I don't make the criteria, but the essential to many of us in the community is.
We were able to stay open. We're an essential business, so they were afraid of something called prohibition back in the 20s, I guess.
Yes, but yes, I did notice, Denise, thank you for mentioning that. I went to Myers today, and I did notice they were vaccinating folks.
Mm-hmm.
And following the, I asked, and they said they follow the criteria by the state. So
I can tell they're nervous though doing it.
Oh yeah, I'm sure they are because they're pharmacists. So, thank you everybody for everything. Unless anything else comes up, I'd like to then entertain a motion to adjourn. I see Michael D'Amico said hi. Okay, thank you for motioning to adjourn. Second.
A second.
Thank you, Denise. There's being no further discussion. Oh, before we go, the next meeting is May 6th at 4 p.m. It's a Thursday. So, but if there be no further discussion, all in favor?
Aye.
Opposed? Abstentions? Great. Thanks, everybody.
Bye.
Yes,
thanks.
Mr. B, I'll call you. You call me. Thank you. Thanks, everybody. Have a good night.
You
And
too.
thank you, guests, for coming.